welcome to Your Brain Can Be Rewired, where the goal is to learn about how learning occurs and why learning and education is so important when addressing mental disorder. I already discussed common treatments such as medication, counseling, and therapy, and that medication is best partnered with counseling and therapy. So now we're going to understand how to apply some theory, and we're going to learn some theory and how to apply some theory that can be used in your community settings. Through her science of thought application, Dr. Carolyn Leaf found time and time again that even people with the most extreme mental disorders and disabilities can learn to live fulfilling lives.
You can say hello to them if you want to. They grew up with this stuff. I've used this stuff my whole life. What is this stuff? This stuff is that your mind is so incredibly powerful. You have a powerful mind. You have a sound mind. You have a mind that is able to achieve what your dreams are. You are as intelligent as you want to be. I stand up here saying this with conviction because I have seen this over and over and over in so many different circumstances. When I came to the United States,
Science of thought theory says that the mind, the conscious part of the self, can rewire this brain. This implies the mind and brain are separate. They influence each other, but they are separate. The plastic paradox says that the brain, including chemical imbalances, will respond to how your mind functions, since you are an intellectual being. Dr. Carolyn Leaf believes that the brain changes when you focus your attention, when you engage in learning and analyzing information. This is also referred to in ancient Egyptian society, ancient Kemet, as steba, deep thought.
Showing them how to learn. When you direct your attention, when you apply a disciplined, directed, deep focused thinking, when you sit down with your whatever it is that you are learning, whether it is on a university level, school level, business level, whatever you are looking at, whatever you are studying, whatever knowledge it is that you are trying to master, when you sit down with your mind and you direct your attention, that repeated effort, when you direct your attention in a repeated way, will cause learning to take place. Learning is...
Dr. Carolyn Leaf has worked with a variety of clients with learning disabilities, traumatic brain injuries, children and adults with developmental disabilities, and people with mental illnesses. When she first began her clinical studies, she was always told by lecturers and scientists to teach patients to compensate. However, she chose to believe that her clients would be able to do otherwise.
You're a thinking being. You think all day long. You are always thinking. During the day, you are thinking, you are choosing, and you are building thoughts. Thoughts are memories, and thoughts are real things. Memories are real things. So as you are sitting with your schoolwork, as you are doing whatever you are doing in life, and you read and you ask yourself, what am I reading? And you answer yourself, and you discuss it with yourself. As you do this disciplined mind work, you are driving your malleable brain to grow branches. You are literally growing branches on these neurons inside of your brain.
The brain responds to how your mind functions, thinks, analyzes, and applies intellect. The person must first make a decision to learn, then engage in deep thinking, focus on what's at the task at hand. Analyze information. This means to review, ask yourself and others questions, compare results, and then discuss your work. This is logical deduction, and the more you do it, and the more you apply yourself, you are changing the brain. And that can be done for good or for bad. Now, you may be thinking that a person with a mental disorder can only apply and focus and engage in deep thinking if they have that ability to do so. And this is true, as some mental disorders do distinguish somebody's ability to apply themselves. This is true. This is why medications have been developed. There's herbal medications and pharmaceuticals have been developed to help people come to a state where they can apply their mind. And that's for more mental illnesses where people experience psychotic symptoms. However, what about people with mental disorders or developmental and intellectual disorders? They need more hands-on learning, more step-by-step processing, and more patience to understand how to do something. So, rather than all behaviors being motivated and controlled by thoughts, behavioral analysts see how people with certain disorders can also benefit from what is called applied behavioral analysis, the study of behaviors and their relationships to their environment. They ask questions such as, how does one's environment, such as the people around them, the situations, the reward, the consequences around them, affect their behaviors? And how may they improve someone's life by then changing their environment? And the use of reinforcement and punishment is used to shape behavior. ABA is popular for people with developmental disabilities such as autism. However, it is proven to be effective for some types of mental disorders such as depression and anxiety. Now, ABA may seem like a very technical process, which it is, because it's used for people with extreme mental disorders and and intellectual and developmental disabilities. However, these principles are being used every day. We just don't realize we're doing them. So now let's take a look at some psychotherapy theory and its application in the real world. Remember, therapy is not this scary thing. It's really just a more hands-on learning approach to teaching individuals to do things that bring more fulfillment in their life. A phobia is a marked, long-lasting fear of an object or situation that is out of proportion to real danger. It must interfere with normal everyday functioning in order to be considered a disorder. So a fear of a spider wouldn't be a phobia, since the average person doesn't come into contact with one on a regular basis. However, the fear of tight spaces could perhaps be a phobia, since it could prohibit someone from using an elevator or riding in a car or getting on a plane, things that are in their natural environment. Phobias are learned. They're wired into the brain, and they usually are learned during a childhood experience where a child is exposed to something fearful and then never exposed to it again in order to combat that fearful experience. So take for instance a child younger than 2 walks up to a dog to pet it all happily and curious, and the dog snaps at it and bites it, and then the child runs away crying. If the child is not soon re-exposed to a dog or even that same dog without that same fearful experience, they're probably going to grow up with a fear for animals or a fear for dogs in particular, even if they don't remember that traumatic experience. Fear of abandonment is not an official diagnosis found in the DSM. However, this issue does exist. I would suggest it doesn't exist in the DSM because emotional issues such as these require more intensive engagement in order to uncover underlying issues. And they require an engagement that science has not yet figured out to address in a systematic way. Also, one could argue that it will require more engagement than the insurance companies are willing to pay for. So just like fears are learned, they can be unlearned through a process called systematic desensitization. This is where a person is gradually exposed, and then you gradually expose them considering duration and time and distance from the fearful object, depending on the person. And eventually they'll learn that there's no real danger associated. Now, if you have a fear of abandonment, you may want guidance in this process. You don't want to just start out in relationships without first changing the way you think and or approach a new relationship. Cognitive behavior therapy is used to help people with anxiety and depression, and is found to be just as effective as SSRI medications, and it's best, but however, it's best when paired with the therapy, especially if the person is experiencing more severe forms of emotional disorders. This therapy helps clients to recognize self-defeating ways of thinking, which every single person has and has to work through overcoming. And it encourages the learner to break out that cycle. Now, here are actual psychotherapy content that was used at an outpatient behavioral center for patients who had some of the most extreme mental disorders, including schizophrenia, depression, PTSD, bipolar disorder, borderline personality disorder, and addictive disorders. So please excuse my handwriting, as even as a student there shadowing, I greatly benefited from the topics at hand. If you need more time to take a look at these, please pause the video. So at this outpatient center, the counselors and therapists would take their time and go through each topic with the client, teaching them to think about what they are experiencing and how to engage in self-healing. Sometimes the topics are as basic as learning to recognize what emotion you are experiencing. Other times they may bring on extreme feelings that could signify an area where you still may need more healing. The counselors would even do guided meditation in the therapy sessions. It was a nice thing. There are real benefits to sitting down with content like this and thinking through it. Thinking about what an emotion is. What are you feeling? What is the feeling caused by? Which may include considering past traumas. And then considering how you can better serve yourself, your mental health. This is self-reflection. This is the type of learning, deep thinking needed to rewire your brain. Learning actually addresses 1 out of the 6 human needs to maintain or sustain psychological well-being, as identified by Cure Relief. Furthermore, it's needed within a community. This is the only way that an individual can learn. No matter the method used to treat mental challenges, there is one commonality between them all: the presence of a caring guide. The guide is the caretaker, the therapist, the counselor, or person dedicating to themselves for the care of someone with a mental disorder. These individuals have developed their ability to listen to people's needs beyond what the person says. Interactions are more than verbal, they are nonverbal as well. Also, these caregivers, they emphasize what the struggles a person is experiencing, yet still able to maintain their individuality. They're patient in walking with the individual through challenges that may seem impossible at first. Last but not least, the caregiver has researched effective ways to be of service. And the same is for everybody. Even if you don't have a mental disorder, we all have places in our life that we can learn to improve on. And how can we learn if nobody takes the time to explain it to us? So thank you so much for joining me for Your Brain Can Be Rewired. I hope you learned some applicable theories and techniques for maintaining and sustaining your mental health that can be shared in your community.